Good morning. Today is Saturday, August 21st, 2021. Today is our regular Saturday morning yoga therapy class. Today's topic will be the pranayama, the transformative power of lifestyle medicine. Last Saturday, we discussed in details what is lifestyle medicine. We showed some asanas, pranayamas, and meditation as a therapy for lifestyle medicine. Today, we'll be discussing and demonstrating the most important component of the therapeutic component for lifestyle related disorder is your pranayama. As all you know that we talk about all the time, the yoga, it's an anglicized version of the word called yoga. It's a union of your body, mind, and spirit. It's a philosophy, 196 small aphorism called sutras, of which 193 is to take care of your mind. The practice has 8 limbs, and the 8 limbs, the yam, the social restraint, niyam, the personal restraint, asanas, the alignment, both external and internal, pranayama, the voluntary regulated breathing, pratyahara, control of your 5 senses, dharan is the focus, dhyan is the meditation, samadhi is the union of your body, mind, and spirit. So all these practices leads to a activation of your emotional brain called the limbic system, or the control of the activation of the limbic system. Essentially, it creates a relaxation response, increasing the parasympathetic tone through a phenomena called psychoneuroendocrinology. From limbic system, it sends a signal to your hypothalamus. Hypothalamus sends a signal to your pituitary gland, pituitary adrenal axis, which corrects our hormonal changes, which we call hormonal homeostasis. It also shifts the autonomic nervous system more towards parasympathetic tone, and also a rapid shift from sympathetic to parasympathetic tone. On the other hand, lifestyle-related disorders or diseases are due to we call it a stress activation of our emotional brain called limbic system, and a high sympathetic overdrive. Sympathetic tone, which is called fright and flight response, is extremely high. Parasympathetic tone, on the other hand, is called a calm and digest. Lifestyle-related disease, what we call a metabolic syndrome, again, it comes from your stress. Stress is a fear of unknown, the fear which you don't know what is going to happen. What is happening in Afghanistan, or what is happening when I'm looking at the news media. So essentially, a cascade of phenomena, it secretes cortisol. Cortisol converts your excess sugar to your omental fat, what is called a truncal obesity. The omental fat is inside your abdomen. The omental fat acts like an inflammatory molecule. It secretes adiponectin and pro-inflammatory molecules. which causes a chronic inflammation, leads to diabetes, hypertension, coronary artery disease, or you call it atherosclerotic arterial disease throughout the whole body, dyslipidemia, or a high cholesterol, or a high triglyceride and a low HDL, and all combines called metabolic syndrome. Practice of yoga converts this disease, which in Sanskrit called rogi, to a person without any disease. And in Sanskrit, it's called your nirogi. Nirogi means patients have no disease and essentially healthy. And when you continue this practice a little longer, you become a yogi and yogini. You enjoy a disease-free, medication-free, a healthy lifestyle. So for the pranayama, which we recommend for the people with a disease, because remember, people who has a truncal obesity, or people who has a diabetes, has a hypertension, coronary artery disease, or have a recent open heart surgery, like somebody asked me, what kind of practice should I do when I have a bypass surgery? It takes about 6 weeks, 6 to 8 weeks for recovery after surgery. After following 6 weeks, you'll be able to start all the practices very slowly, without any pain, with complete effortless breathing, and in stages to transform yourself from a disease-ridden body and mind to a completely disease-free body and mind. Pranayama. Prana is a life force. It is a subtle energy which keeps us awake, alert, and alive. It is not the breath. Breath is the carrier of your prana. Metaphorically, prana will be like electricity, and breath will be like your electric cable. Yama is a control and restraint, so you will understand and know that how to control and restrain your breath and how to use it as a therapeutic tool. Initially, when you have a disease or you had immediately after an acute event, what you have find it is called integrative medicine. That most of your chronic lifestyle related diseases starts with an acute onset. During acute onset, we use our usual and customary practices. If you have a breast cancer, you may need a surgery, radiation, chemotherapy. But remember, after a breast cancer is treated, 5 years, 10 years, 15 years down the line, breast cancer comes back again. Because it's a genetic called oncogene, but gene has to express. The practice of yoga has been shown also to prevent or cause the suppression of the oncogenes, so it doesn't come back. Same as a heart disease, if you have acute myocardial infarction, you get angioplasty, you get a bypass, whatever needs to be done, you get aspirin, statin, beta blocker, ACE inhibitor, all the gamuts of treatment you get, but you incorporate yoga therapy, which is the relaxation response, parasympathetic activation with the practice. Slowly and slowly it takes over. And it takes over, then your doctor will be slowly and slowly will start reducing your pharmaceutical support. That means reducing the medications you are taking. You'll be enjoying a quality life. You'll be like Energizer Buddy. You'll be enjoying like me. I had open heart surgery over 20 years back. I'm enjoying a very nice quality life. So let's start the practice. Person comes to you or comes to me who had an acute coronary event or have an acute fulminant hypertension or a severe diabetes, may not be able to sit down in the ground, we let them sit down in a chair. First, we create a relaxation. Remember, most of the yoga teachers says, yes, we go ahead and start a pranayama practice. You can do a pranayama practice initially, but you need to learn how to create a relaxation of your respiratory muscles. Unless your muscles of the breathing, muscles of the respirations are relaxed, you are not able to do a effortless breathing practice. Remember, most of the people sees a practicing yogi doing a very rapid Kapalbhati pranayama, rapid Bhastrika pranayama, hours or maybe minutes and minutes of Anulom Vilom pranayama. But remember, they have been doing it for so long that they can do those completely effortlessly. What does effortlessly means? You will be able to talk, you'll be able to sing. So you will be your own judge and your guide, and you will proceed accordingly. So able to keep your spine straight. See, if I'm sitting down, you're sitting in a chair or sitting in a ground, makes no difference. Remember, I had to cross my legs. You cross your feet, put down both the feet on both sides, underneath the knees, keep your spine straight. And after a short time, what you do, change your feet. What happens, you activate both sides of your brain. Remember, I'm right-handed, right-footed. I'm always using my left side of my brain. But I need to use my right side of the brain because when the both side of the brain has been properly activated and working, that is also a therapeutic tool. To give you an example, I'm sitting here, short time, I'm going to cross my leg and sit down again in a cross-legged position. In a cross-legged position, first, even sitting in a chair also, keeping your spine straight. First, I use few component, my hand. Hand is called a mudras, hand gesture. Hand connects your body and mind. Before a pranayama practice, you need to quiet down your mind. And how to quiet your mind? You touch your index finger and thumb. This is called mudras, and there is a lot of mudras. Mudras are psychophysical connector of moving prana to the organ of healing. So we'll talk about mudras again, which we have done a few times before, the therapeutic mudras. But this is your call Dhyana mudra or Jnana mudra, quiets down your mind and put it in the top. You've always seen people talk with the hands. Even the hand moves faster than your tongue. If you want something, I will put my hand for this to give it to me. Isn't it amazing when you see that? If you find something, say something good, you'll say this, then you say, oh, wow, what a dish. So hand, also remember our brain, a functioning brain, half of the brain controls our hands. 1/4 of the brain controls my head and neck. Another 1/4 controls the rest of my body. It's called human homunculus. I have a beautiful picture in my book, you'll be able to see. Next are 5 senses. I see, I hear, I smell, I taste, and I touch. 5 senses keeps me awake, alert, and active. And most important sense is my vision. I close my eyes. So these are the steps I'm going to do because I have a disease or I may have an immediate post-coronary event. I may have a bypass surgery. And then we'll go slowly and show you in steps how do you increase it completely effortlessly. 4th component is bring your power of your breath. Lung is like a balloon. It has a 6-liter capacity. We need 1.5 liter to keep the lung open or expanded. At 4.5 liter, which I can exchange, we call vital capacity, both as an inspiratory reserve, expiratory reserve. But normally my breathing is only 500 cc, 0.5 liter, which is called tidal volume. So I have about 80 to 90% reserve in my lung. Bringing a fresh oxygen is also relaxation. Example being, if you get a back pain is primarily due to a herniated disc or a spinal stenosis, which irritates the nerve and essentially causes the muscle spasm, tightening of the muscle, causing pain. When you put a heating pad, your pain goes away. Heating opens up the blood vessels, called vasodilatation. It brings more oxygen to the muscles, and the muscle relaxes. When the muscle relaxes, the pain goes away. So learn how to breathe out first. And breathing out, also exhalation is parasympathetic, inhalation is sympathetic. Slowly take a deep breath in. Breathe out longer than breathing in. You practice this effortlessly and you'll see what is happening to me. I'm having some saliva in my mouth. When you have saliva in your mouth, that means you are having a parasympathetic activation. When you're fearful, when you're afraid, you get a dry mouth. Dry mouth is a sign of sympathetic activation. If you want to start practicing, want to practice with me, start very simply. Breathe out first. Breathe in with a count of 2 in, 1 and 2 in, count of 4 out. 1 and 2 and a 3 and a 4 out. I'm feeling so relaxed, I can progress. I can take my heel all the way to the back. I put my foot on the, this is called your Siddhasana, a perfect pose. It progresses. And also what you can do, you can change when you get a relaxation through incorporating your mudras, bandhas, kriyas, and pranayamas. You could feel your physical body get relaxed and your breathing gets better. When the physical body is tight, the breathing is also very tight. So let's practice. We've been doing it for a long time. I can easily do a count of 10 in, count of 20 out. But for all of you, let's try with the count of 3 in, count of 6 out. Breathe out first. Count of 3 in. Count of 6 out. Very easy and simple for me because I've been doing it for a long time. Just to demonstrate to you, then you go slowly. Count of 4 in, count of 8 out. But remember, you have to talk, you have to sing as if it is your normal breathing. So let me show you another example. It's a count of 6 in, count of 12 out. I'm breathing out first. Count of 6 in. Count of 12 out. This is entirely normal. I'm talking, I'm smiling, I'm breathing. Only things happening, my body is slowly and slowly getting relaxed, and I feel the relaxation in my body and mind. Maybe show you one more time. Let me count of 8 in, count of 16 out. Breathe out first. Count of 8 in. Count of 16 out. As simple, and it's a wonderful practice when you do that. When you relax, you can go back to your half lotus, Ardha Padmasana. No pain, effortless breathing. Completely feel the sense of relaxation. It's a wonderful practice. Supper relaxation. I put my hand in between my toes. I've shown it multiple times. It relaxes your toes, relaxes your lower part of the body. I sit down like this. Remember, you cannot do the pranayama unless your body and mind is relaxed, because your breathing will be tight and it will be worse. That's what you always see. There is a sign always says, do not practice pranayama. You get a proper teacher to teach you. Pranayama is going to hurt you. Yes, if you don't prepare yourself, pranayama will hurt you. That's what even in the practice of yoga, asanas, relaxation. Asana is relaxation, comes before pranayama. Another is called five senses. You bring relaxation through your, called your bumblebee breathing, Brahmri pranayam. Shut down your five senses, then you create a vibration with the bumblebee. Brain has a vibration, two frequency cancels, and the mind quiets down. You do pumping and cupping, rub your hands to get a little warmth, then relaxation of your eyes, relaxation of your facial muscles, massage your ear, which is a branch of your vagus nerve called auricular branch, activate your vagus nerve, stimulate your carotid sinus, which is also relaxation, massage the muscles, insertion, sternomastoid, and trapezius, which is supplied by the branch of cranial nerves. So when you feel that sense of relaxation, you always try to do activate both sides of your brain. So I'm on one side. So in a Brahmri pranayam, if you're doing with me, put your index finger in the forehead, use your three fingers to close your eyes, or you can do what is called a Shanmukhi mudra and use your thumb to close your ear. You breathe out first, always breathe through your nostril because it secretes your nitric oxide. Breathe out first, take a deep breath in through the nostril and breathe out with the sound of a bumblebee. Take both the hands, rub your hands, rub your hands. When you feel the warmth in your hand, it's called pumping and cupping. Use both the hands like a cup. Put it over your eyes. Let the eyes take all the heat from your hand. It causes the relaxation of your eyes. Remember, eyes is a direct extension of your brain. So the optic nerve, it connects, massage your forehead. The muscles of the face are connected to your skin. So all the frowning goes away, the line goes away, massage your muscles. Go to the back of the ear, front of the ear. In fact, even inside the external ear canal, that's the activation of your auricular branch of vagus nerve. Massage your carotid sinuses here, which creates the relaxation response. Go to the back, massage the insertion of sternomastoid and trapezius muscle, which are supplied by your cranial nerve. A prayer pose to the back, relaxation of the neck called Brahma Mudra, relaxation of the neck with your sound of your bumblebee called Brahmari Pranayam. I've shown all of these things to you before, and even the last time I also shown, those also brings a proper relaxation. See here, I'm sitting in a lotus position, and I feel good. People say, oh, look at, oh my God, how he's sitting down. No, I came in stages. I came in stages. I feel a profound relaxation. And biggest example is you can see my mouth still wet. I'm talking. My mouth doesn't get dry. So people will see when they're giving a talk and they're sipping little water, that means it is not the dryness of their mouth. They didn't talk that much. It is a stage fright. It's a fear when they're presenting, which causes dry mouth. Able to do a prayer pose to the back. Put your hands in the back. Bring it up to a prayer pose, which you have seen many times. I do it all the time. I do it all the practice. Prayer pose to the back. Keep my eyes closed. Do my all the neck rotation with the breathing. Breathe in. When breathing out, I do the bumblebee breathing. Do my side to side. I've done it so many times, do the side to side. So just for the sake of time, just to tell you, just keep doing it. Look all the way to the back with your breathing. Best to do breathing out first. Deep breath in. Breathe out the sound of a bumblebee. Rotate your neck. Once you achieve the relaxation, the first pranayama you do called Bhastrika, bellows. Bellows is a active inhalation, active exhalation. And remember, going against the grain of your habit is yoga. So, normal breathing is active inhalation, passive exhalation. So here you are doing both active inhalation and active exhalation. Bhastrika is a bellows, the bellows, when they use the bellows for your fireplace or blacksmiths, they used to do it. So in the bellows, it will be like, they will expand the bellows. This will be your rhythm. And how much you do is slowly and slowly you build up. We give you a guideline. That's what we want to do. It is a beginning of pranayama. It clears all the carbon dioxide away and brings the fresh oxygen back in. A lot of people ask me, what is the physiological changes? When carbon dioxide is released, it creates a sense of called a respiratory alkalosis. the blood pH goes high up. Calcium, ionic calcium gets bound with albumin, so the ionic calcium goes down. You have a sensation of tetany. Tetany is a muscle contraction. You get a circummoral numbness, you get a sometimes dizziness, you get a tingling, then you get a carpopedal spasm, you get a spasm in your hands. So these are a globus, called a globus hystericus. These are all signs of your Bhastrika pranayama. It's entirely normal. So at the beginning, what you can do, you can also do with your, we do also in the morning. In the morning, we do a called a jalneti. Wash your nose to be your nose are, both the nose are open. You can do slowly, you can raise your hands high up. And when you are, a disease state, slowly bring it down. I always do my eyes closed. I breathe out first, take a deep breath in, active, and actively pull it down. You do it as much as your breath will allow you. What is a normal, effortless breathing? Again and again, I'm emphasizing, you can talk, you can sing, it will be a normal breathing. There will be no effort in breathing. Remember that. So slowly and slowly in stages, you will do it. When you transform from rogi to nirogi, from disease to no disease, healthy. You can do, say, you can always do it with all the asana practice. You can get deep, like your sit-ups, push-ups you can do, or you can do it faster. But I'm effortless. That is the bottom line. Or you can do just moving your shoulder. I can continue. I practice daily. I've done about 30, 35 of them. I do 50, 75, 100. I do it very rapidly. And I do in hundreds. But you do it as long as the body will allow. People ask me, do I do Bhastrika very slowly? Yes, you do start very slowly. But once you start advancing, you do a little faster and faster, but to be sure it is your normal effortless breathing. So a relaxation in the hand is called a Adhi Mudra or a Balu Mushti Mudra, like baby's fist. Baby puts a thumb inside and closes. You get relaxed. Put your hand here. And I'll be doing a very rapid Bhastrika Pranayama, but completely effortlessly. Let me show you one example so you will understand what I'm talking about. And if you want to do with me, you're welcome. I can do about maybe 300, 400, 500. But let me do about 100 or 200. Let me show it to you how fast you can do it. I did 250, but totally effortless, but my lung is totally empty now. I breathe out, take a deep breath in, and breathe out. Now I can breathe in and out maybe about 3, 4, 5 times the normal amount which I could breathe normally. It's when your lung is empty and you breathe, it's a sensation you only can perceive. There's no language you can even describe and explain. Wonderful feeling. My whole body gets warmed up. It's called work of breathing. The tremendous amount of muscle work needs to your breath. You'll be surprised. Like when you put the patient on ventilator, respirator, we have to give them additional nutrition. We call it a TPN, total parenteral nutrition. We give them extra calories because a tremendous amount of energy gets burned in your respiratory movement. So you go from called rogi, that means people with a disease, to nirogi, people have no disease, then you got a yogi. Rogi does very slowly. Rogi does follow their own body's responses, no pain, effortless breathing. Nirogi goes by called Agni, igniting Agni. We also do it in a sequence, raising hand high up, a slow 20, medium 20, a rapid 20. I do it in one cycle. Then I repeat the cycle, 2 cycle, 3 cycle, 4 cycle. And for my daily practice, I do it every single day. I don't leave home without doing a Bhastrika Pranayama. I do changes my asana practice, but I have a fixed 7 or 8 of pranayama every single day. I do it. Slow, same way. You can see I'll be doing slowly. Let's do 20. If you're doing it with me, you can do it. Do with your eyes closed, your mind goes into your breathing. Slow 20. I can do medium speed 20. Then I do a rapid 20. It is one cycle. Talking and breathing removes all the carbon dioxide, brings fresh oxygen in. Wonderful therapy for your pulmonary diseases, asthma, COPD, pulmonary fibrosis, you can name it. Bringing more oxygen in, it causes Aerobic glycolysis. Like in a sugar, when you don't have enough oxygen, it causes the anaerobic glycolysis. It produces carbon dioxide, water, lactic acid, pyruvic acid, pain-producing substance that make your life miserable. Moment you bring your oxygen back in, you produce carbon dioxide, water, and ATP, adenosine triphosphate, the energy. Aerobic glycolysis is a basic chemistry. All the toxic material, what are the toxic material? Lactic acid, pyruvic acid, pain-producing substances. Improper metabolism. So I'm sitting here for a while, so I'm going to change my posture. This is very, very important. You like to be in a relaxation, that's very good. But you don't want to be what is called neuroplasticity. See, my brain allows me to sit like this. I can sit down with your relaxation of the lower extremities, relaxation of your toes, relax your ankle joint, breathe in, breathe out, slowly move your ankle joints. It's a wonderful practice. After Bhastrika, I do a practice called Kapalbhati Pranayama. Kapalbhati Pranayama is again what is a active exhalation, passive inhalation without knowing. Completely opposite of normal breathing. What the normal breathing was: active inhalation, passive exhalation. I have a balloon here in my chest. I have a diaphragm here and balloon here. I bring my awareness on my belly button. I push my belly button in. It squeezes this balloon. It hits the diaphragm, hits the other balloon, air comes out. Nothing else moves, only belly button goes back in. And we do it all the mudras. Remember, doing pranayamas with mudras, we do about 8 or 10 mudras. First is called Gyano Mudra or Dhanu Mudra, whites down your mind. Put your index finger down, call it Vayu Mudra. It controls your vata, controls your pain, and your movement in the body. Middle finger and thumb, Shunda Mudra, improves your hearing. Ring finger and thumb, Prithvi Mudra, grounding. It helps with the people with diabetes, truncal obesity. Little finger and thumb, Varun Mudra. It helps you in controlling your bladder function, fluid in the body, skin health. Ring finger, little finger and thumb, Shakti Mudra, Prana Mudra. It helps you bringing more strength in your body. Middle finger, ring finger and thumb, Apana Mudra, Pachan Mudra. It is all excretion, removing all the toxins from your body. Pachan, digestion. Index finger down is called Apna Vayu Mudra, called Hriday Mudra. It is very efficient for your cardiopulmonary function. Put your hands together, thumb up, Linga Mudra. It improves the heat in your body, helps your phlegma to come out. A lot of other. Ganesh Mudra. You have Shankha Mudra, Hakini Mudra, Dhenu Mudra. I've done all this in a mudra session. We'll do another mudra session, so you will see. It just balances both sides of your body. So before doing a Kapalbhati Pranayama, you try. Push your abdomen in, so air comes out. And also with both the nostrils, you want to be sure both the nostrils are clearly open. Many a time you'll see your one nostril is more open than the other one. We'll do the next one. It's called alternate nostril breathing, or called Anulom Vilom Pranayama. That time you'll see both the nostrils will be checking. So I'm closing my right nostril. See if air comes out from my left nostril. It's nice. Left nostril closed, say the right nostril now. I can see my left nostril is less open than the right. Yogis do, they put a pressure under their opposite armpit. It opens the opposite nostril. Or they lay down in the opposite side. They lay down on the right side, the left nostril opens up. Lay down on the left side, right nostril opens up. So touch your index finger, thumb. Generally, I do about 50 with each mudras. With the practice, we do a 1 hour of practice, 25 minutes of asanas, 25 minutes pranayama, 10 minutes of meditation. And during pranayama, we do a Vastrika pranayama, maybe 2 to 3 minutes. Kapalbhati pranayama, whatever your body will allow, and slowly we bring it up to around 5 to 10 minutes. Wonderful practice for your diabetes and your truncal obesity. Close my eyes, spine straight, my awareness in the belly button, and only belly button goes back. See, I did not pay attention to my breath. The only thing I did, I put my belly button to the back and see my air will come out. Nothing moves, nothing in the body moves. Many said, I cannot do it. I said, okay, can you cough? Give me a cough. So now you cough with your mouth closed. Mouth closed, you have to cough. That's Kapalbhati Pranayama. So let's do it for a set. So I will do about the 10 with each mudras, just for the sake of time, and explain the benefit of this. Start with the Dhyana Mudra. Close your eyes. For practicing with me, start the practice. Change your mudras to Vayu Mudra. Keep doing it. Let me tell you the benefit. You keep doing it. Massages your liver. Massages your stomach. Massages your spleen. Massages your pancreas. Massages your large intestine. Massage your small intestine. For men, it massages the prostate. Change your mudra again. For women, it massages your ovaries, uterus, fallopian tubes. And every time you massage an organ, the function of the organ gets better. It's a wonderful practice also for women who are infertile. Infertile women, that means uterus, tubes, and ovaries are not functioning. But with this, it's functioning, they become pregnant again. Change your mudras to Prithvi Mudra. This will be for your diabetes and truncal obesity. The treatment of diabetes and truncal obesity is able to sit down with the spine straight and do the Kapalbhati Pranayama with this Prithvi Mudra as long as your body will allow and your final goal is between 5 to 10 minutes. Varun Mudra, it improves your bladder function. For women who had a stress incontinence, urine comes out during coughing and sneezing. Powerful for the men with a prostate enlargement. This is a wonderful practice. Touch this, do Kapalbhati Pranayama. It also massages your diaphragm, way high up. Above the diaphragm, you have two lungs. It massages your lungs. So all the residual air in the lung comes out. All the toxins in the body starts to come out. Change your mudra to your Shakti mudra. So all my body toxins, like my urine, my stool, my perspiration, has to come out when it's time. But all the toxins in the lung, I can remove of my own will. I can take care of it by my own function. Panchal mudra. In between the lung lies your heart. It also massages the heart, massaging the lower part of the heart. Massaging the heart improves the heart function. When a heart stops, we do a chest compression called CPR, cardiopulmonary resuscitation. It is like an internal CPR. I'm doing massaging heart from inside. So this is called your Hriday Mudra, touching touching a middle finger, ring finger and thumb. Index finger is down. This is good for your heart function, lung function, and I do your Kapalbhati Pranayama. Wonderful for your lifestyle-related disorder called coronary artery disease. I had a coronary artery disease. I had open heart surgery 20 years back, and that's what I do. I do daily practice with the Hriday Mudra, Kapalbhati Pranayama. Linga Mudra is a wonderful because it brings the heat and removal of the phlegma. Kapalbhati. Kapal is a forehead, Bhati is a shining. When you keep doing it, looks like you are shining. You have an aura around your face. Like you'll see a picture of Buddha, picture of Jesus, you'll see aura around their face. That's what people say, that you are glowing. When you're practicing yoga, you say you're glowing. People will tell you when you're doing it. People tell me, you look like you're glowing. Generally, Kapalbhati Pranayama is followed by your Anulom Vilom Pranayama, alternate nostril breathing, but I want to show you a little bit. It's called the breath holding. Breath holding in inhalation, breath holding in exhalation. Very simple breath holding is called a Savitri Pranayama. In a Savitri Pranayama, always try to do the hand mudras so it quiets your mind. Savitri, you just do a breathe out first. You do an inhalation, say a count of 4, holding for a count of 4, exhalation count of 4, and breath holding after exhalation count of 4. You can do varies everything. You can do 1:2, 1:4. You can do 1:4:2, but try with just a simple 1:1:1:1. Inhalation is called Puroka in Sanskrit. Breath holding in inhalation, is called kumbhak, abhantarin kumbhak. Exhalation is called rechak, and breath holding after exhalation is called suspension. Retention, breath holding after inhalation, and suspension, called Bajja Kumbha. Simple practice. I'll just show you the technique, but you can do it a lot more. Breathe out first. Breathe in with a count of 4 in. Hold for count of 4. Breathe out with a count of 4 out. Hold your breath for count of 4. Now we can do it without talking once. I'll show you another one breath holding when I show the alternate nostril breathing. This breath holding also comes with your called bandhas or locks. You have a chin lock, abdominal lock, and a root lock. Mula bandh, Udyani bandh, Jalandhar bandh. In a chin lock, you practice breath holding and inhalation. You keep your spine straight, don't bend your neck, slowly bring your chin down, touch your chin to the chest, and stay here. It stimulates the 2 organs on the side of your neck called carotid sinus. Massaging that causes stimulation of your vagal input. So I'm always changing my foot. You see that I'm always changing my position because I don't want the neuroplasticity to take over. I want the neuroplasticity to let me sit down like this, but all multiple postures. So the way to do it is called a Murcha Pranayam. You breathe out first, take a deep breath in, and hold your breath. Remember, the most important stress in our life is your insomnia and sleep apnea. Insomnia and sleep apnea activates your limbic system. It is a root cause of your whole lifestyle-related disorders, metabolic syndrome, diabetes. If you see that at night you don't sleep well, your blood sugar goes high up. Person with the coronary artery disease, everything is normal. Only thing that he could not sleep or she couldn't sleep. Let me show you Murcha Pranayam one time, and I will explain to you again. Breathe out first. Take a deep breath in. Hold your breath and do a chin lock. Now we keep on counting how long you can hold, like a 1 and a 2 and a 3. It is so relaxing, it is called Murcha Pranayama. When you hold your breath, the whole lung expands. When that lung expands, it cannot expand too much because we have a thoracic cage, bone. So the lung, the pleura, the covering gets stimulated with the nerve called vagus nerve, and it pushes the lung back into normal position. It's a physiological changes called a Hering-Brewer reflex. With the Hering-Brewer reflex, we activate the vagus nerve. which is a parasympathetic tone. Wonderful tool to put you to sleep. Insomnia. Treatment for insomnia is your bumblebee breathing, Bhramri Pranayam, and this Murcha Pranayam. This is breath holding and inhalation. Breath holding and exhalation. You breathe out first. You take a deep breath in and you breathe out. Then you suck your stomach in and then you hold. So breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. When I'm holding it, this is called abdominal lock or Uddiyani Bandh. I'm also incorporating my chin lock. I'm also doing a root lock. In a root lock, you contract your pelvic floor, control your anal sphincter, you pull it up. It is called a great lock. Mahabandha. The abdominal lock increases the negative intra-abdominal pressure. For the perfusion of the abdominal organ, innervation of the abdominal organ gets better and better. If you have a hernia, which pushes because of positive pressure, it creates a negative pressure. It's very good for hernias. It then follows, then very good for diabetes and truncal obesity. It follows with called a Agni Sarkriya. You'll be sucking your stomach wall in and then you move it to massage all the internal organs. I do it every single day. Generally, I do it between the Uddiyani Bandh, abdominal lock, and Agni Sarkriya about 5 to 10 times. Let me show you one time. So breathe out first. Deep breath in. Completely breathe out. Suck your stomach in and move. Basically, you're holding your breath and you're massaging all the abdominal organ. There cannot be a better functional therapy. People with truncal obesity, diabetes, and all the intra-abdominal organ problem. Inflammatory bowel disease, irritable bowel syndrome. Remember, all the gastrointestinal diseases, mostly of them are functional. The moment you create the parasympathetic activation, the gastrointestinal activity gets better and better. Follows with alternate nostril breathing. The moment you do it with the left hand, you create a mudra, again, Dhana mudra, Gana mudra. Close your right nostril, breathe out through your left nostril first. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. Keep on doing it. Let me tell you the benefit. Left nostril is supplied by your right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Right brain is parasympathetic. Left nostril breathing is called cooling, Chandranari, moon energy, or a parasympathetic activation. Right nostril is controlled by the left brain. Left brain is analytical. Left brain is heating. Left brain is male. Left brain is sympathetic. Right nostril breathing is called heating, Suranari, sun energy, and sympathetic. Activates both sides of the brain. Wonderful practice for people who doesn't function both sides of the brain and loses the focus, people with dementia, people with Alzheimer's disease. Wonderful therapy for people with hypertension, people with neuropsychiatric disorders. Slowly bring your index finger and middle finger into the third eye. Close your eyes. Bring your focus in the third eye. Then use your left hand. This is called a super brain yoga when you cross and hold your left earlobe. It activates the opposite side of the brain, brings your focus completely in your third eye, and you keep on doing your alternate nostril breathing. Keep on doing it until you get a little effort. If you don't have any effort, we do between 5 to 10 minutes. When you bring your focus there, slowly and slowly what happens, your focus comes into both the right and left nostril, and you'll be able to do the breathing without closing your nostril. That is called your meditative alternate nostril breathing. And we'll do it at the end, and you'll see how the meditative alternate nostril breathing acts on you. You can incorporate your breath holding with alternate nostril breathing. Nadi Shuddhi Pranayama, channel cleansing. Generally, we do it 1:4:2, and then we can increase any number we want. We start with breathe out first, breathe in with a count of 4 in, breath hold count of 16, breathe out count of 8. When you start doing it like us, when doing it for a long time, we'll do a count of 5 in, 20 hold, 10 out, 6 in, 24 hold, 12 out. Let me show you a count of 4, 16, and 8. And you can keep on doing it until you get very comfortable in it. Close my right nostril, and you do with a mudra called your this. Put your index finger down, middle finger down, put your little finger, ring finger, and thumb, Vishnu mudra, and then you can put it, pinch both the nostril. Breathe out through your left nostril. Breathe in with a count of 4 in. Hold your breath for count of 16. Breathe out with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath for count of 16. Breathe out with the count of 8 out. Keep on doing it more and more, and you can increase the time and the number. The more you do your breath holding, you get a better perfusion, better oxygenation. So wonderful for the present day crisis, what is a COVID situation, and also for a long COVID. We call it a post-COVID long hauler syndrome. We're developing a lot of pulmonary fibrosis, powerful for pulmonary fibrosis. Follow this with a called a Bhramari Pranayam, bumblebee breathing, which you have already done, which is wonderful for your insomnia. One more time, index finger on your forehead, 3 fingers to close your eyes, close your thumb, and breathe out first. Breathe in through your nostril. Follow this with pumping and cupping. It's a wonderful practice. You keep on doing it throughout the whole day. And you feel the heat in your hand. Put your hand over the eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, your face, all the facial muscle, because all the muscles are attached to the skin. Behind your ear, in front of your ear, inside the ear canal. And down, massage your carotid sinuses here, and then in the back, the insertion of the 2 muscles called sternomastoid and trapezius muscle, controlling all the cranial nerve function. Ujjayi Pranayam, Ujjayi means victorious, very good for your sleep apnea. It's a larynx. Larynx is supplied by your superior and inferior laryngeal nerve, which both are the branch of your vagus nerve. The vagus nerve, about 80% is your afferent, means admit. It's a sensory, it takes information to your brainstem. 20% is the efferent or exit, or it comes out. So information, when you start slowly in a relaxed way, constrict your larynx. Remember, it is totally relaxing. That means when you're constricting your Ujjayi Pranayam, it's not that your accessory muscle will work. You are very relaxed. Sends a signal to the brainstem. From the brainstem, a signal comes out, first to the glossopharyngeal nerve, supplies the muscles of your soft palate, palatopharyngeus and palatoglossus, tightness of the muscles, and it controls your snoring. It is a powerful tool for your snoring. Another nerve comes out through your hypoglossal nerve, which supplies your tongue, pushes the tongue in front, so tongue cannot fall back, so it also prevents you from your sleep apnea. Therapy for sleep apnea and snoring. Remember, snoring is a sign of sleep apnea. And sleep apnea is the root cause for all of our lifestyle-related disorder, which is the metabolic syndrome. Hands in a Adhi Mudra. And you will see, I'll show you very gentle Ujjayi Pranayam, both inhalation and exhalation. We call it a Darth Vader breathing, if you know what I'm talking about, or also in your ocean front breathing. Slowly, I will be doing a longer inhalation. Then I will incorporate a chin lock, and then at the end I will do a left nostril breathing. Ujjayi pranayama is very relaxing. Chin lock activates your carotid sinuses. Left nostril breathing, the activation of a parasympathetic tongue. There cannot be any better practice than this to controlling your lifestyle related disorders. Insomnia, sleep apnea, whole gamuts of a metabolic syndrome. So here it is. I'll show it to you. Breathe out first. Take a deep breath in. Completely breathe out. Close your larynx and try to breathe in. It is so relaxing that you get into a relaxation mode. It is so relaxing that you get into relaxation mode. Sorry, what happened? It is so relaxing that you get into a relaxation mode. When you see when I'm doing that, your Ujjayi pranayama, I will have a Uddiyani Bandh abdominal lock same time. What happened here? So when you are doing this Ujjayi pranayama, I'm sorry, let me see here. This is what happened here. Something has happened here. Let me correct it first, please. Here I am. Okay, I'm back. So if you see me doing a Ujjayi pranayama, I will have a abdominal lock without knowing, like this. Can't have any better practice than this. Finally, what is called your meditative. Remember, meditation is a state. Then you prepare your body with called your sthiram sukham asanam. Sthiram means stillness, sukham means happy, asana is your external and internal alignment. Breath becomes completely effortless and you totally enter into a meditation. In meditation, you have a thought process, but you have a repeat thought process. You generate thousands and thousands of thought process, but you generate, it goes in between the thought process. It's called a gap. Slowly and slowly extends your gap. You still have the thought process, but there is no repeat thought process. So the chattering of the mind goes away. Chitta vritti nirodha. So I'll finish with your breathing called breath-centered meditation, followed by alternate nostril breathing without closing your nostril. So for me, say again, remember I'm changing my foot all the time. Now I'm back to my, again, lotus position. I came out of the lotus position, and in sequentially I'm going back to my lotus position again. Both the hands in a Dhyana Mudra or a Jnana Mudra, spine is straight, eyes is closed. Always breathe through your nostril. When you breathe through your nostril, and always visualize. Visualize you are breathing out first through your nostril. Visualize you are breathing through your nostril. Both the nostril is like a filter. It filters all the dirty air you are breathing in. Nose is also your personal air conditioner. Outside air is warm, it will cool it down. If outside air is cold, it will warm it up. Air goes by the side of the nostril called turbinate. Turbinate is like a narrow channel, and it creates a vortex, like that storm, vortex of a storm. That vortex rides over the mucosa of your sinuses, and from the mucosa of the sinuses, it secretes nitric oxide. Nitric oxide is a potential vasodilator, and it also a stimulator for your parasympathetic activation. Coronary arteries get healthy when your endothelium becomes healthy, called endothelial health. Endothelial health comes from the relaxation of the coronary arteries. Also, parasympathetic activation takes place through your nitric oxide, acetylcholine, cyclic GMP. So nasal breathing activates your parasympathetic tone. Visualize air is coming behind your throat, coming to the behind your throat, upper part of the lung, middle part of the lung, lower part of the lung. It comes almost to the level of your belly button. This is called your yogic breathing, dirgha shas. Long breathing. It's a 3-stage breathing. Fills up the lower part of the lung, middle part of the lung, upper part of the lung. Visualize the breath is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. Never do a mouth breathing. If you breathe through your mouth, you don't know where the air has gone. It's gone in your stomach or in your lung. Somebody said, I have to do a mouth breathing. If you have to do a mouth breathing, you can always breathe in through your nostril, breathe out through your mouth. That is a lot more physiological. Now visualize a pranic healing. Visualize your breath is picking up prana. Prana is staying outside your nostril. Breath is picking up prana. Visualize breath is coming through your nostril, the side of your turbinate, over the mucosa of the sinuses, to your opening of your larynx. In yogic tradition, our whole body does breathing, not only lung. Skin does breathing, every organ does your breathing. Visualize slowly and slowly that prana is going to the organ of healing. For me, I visualize prana is coming to my heart to heal my heart. People with back pain, visualize the prana is coming through your back to control your back pain. People with diabetes, visualize prana is coming through your pancreas to increase more insulin. Once the pranic healing takes place, you always can do a little chanting. Chanting can be done with your called Pranava Pranayam. A, U, Ma, and with the three mudras called Chin Mudra, Chinmay Mudra, and Adi Mudra. We'll finish with Pranava Pranayam. In this deep level of your consciousness, when your body mind is connected, you can visualize your subtle body of your mind. Eyes is closed, I can touch anything. I can touch tip of my nose, touch my top of my finger, I'm touching my left earlobe, I'm touching my left great toe. I can clearly see my whole body. I can also clearly see it in both the nostril. I can do a alternate nostril breathing without closing my nostril. Visualize my whole mind comes into the left nostril. Visualize I'm breathing out through your left nostril. Visualize I'm breathing through your left nostril. Breathing out through your right nostril. Breathing in through your right nostril. Breathing out through your left nostril. I can clearly see my air is going through my left nostril, coming out through the right nostril. I keep doing this thing in silence for a while and slowly enter into my meditative state. I can see it. I can feel. I'm touching my tip of my finger. My sensation starts to go down. I can feel the capillary pulsation. I have a health tracker. I have an Apple Watch with me. My heart rate will come down, blood pressure will come down. Slowly and slowly, I do a little pranava pranayama with a chanting. And this mudra, which is called Dhanu mudra or Gyanu mudra, when your palm is up, when your palm is down, this is called a chin mudra. If you close, it opens the lower part of your lung. If you close all the hands, this is called a chinmay mudra, opens the middle part of the lung. And if you take your hand as like a baby fist, called Adhi Mudra or Bala Mushti Mudra, thumb inside and close, it called your Adhi Mudra, opens the upper part of the lung. Will be three chanting and opening three part of the lung, which essentially does the yogic breathing or called the Dirgha Shas, three-stage breathing. Chin Mudra, called A, U, Ma. A is the lower part of the lung, U is the middle part of the lung, Ma is the upper part of the lung. Breathe out first. Take a deep breath in through your nostril. Chinmay Mudra. U. Breathe out first. Deep breath in. O. Adhimudra. Breathe out first. Deep breath in. Bring your hands in front of you, touch the little finger and thumb, separate ring finger, middle finger, and index finger. Lotus Mudra, Padma Mudra connects your body and mind. Slowly bring the Lotus Mudra close to your heart. Heart is the site of your soul, and it does all the healing for us. Pranayama is the transformative power of a lifestyle medicine. Lifestyle medicine became a separate subspecialty of the medicine. They're starting an American College of Lifestyle Medicine. They're going to start a board exam in the lifestyle medicine, and we'll be incorporating yoga therapy as a part of transformation of your lifestyle medicine. Slowly put your hands in front, again do a pumping and cupping, and continue throughout the whole day. This process will activate your relaxation response and parasympathetic activation. Thank you for joining this wonderful session. And I'm also benefited all the time with this practicing, massaging your forehead, eyes, your faces, behind the ear, in front of the ear, inside your ear canal, and carotid sinuses in back of your neck. So the proof here is I've been here over an hour and a half talking to you. My mouth is still wet. I still have a saliva coming up. I did not drink any water. You have seen me all this time. I didn't drink any water. I did not do anything. So this is the activation of parasympathetic tone, activation of the relaxation response, wonderful therapy for lifestyle-related diseases. Thank you for joining. We'll come back again and do another session next Saturday.